You're live on it. Yes. Dr. Manojit.
Right. Am I audible, Niranjan?
Yes, absolutely. Please go ahead. You're live on it. Yes.
A very good evening to one and all present here, and I would like to invite all present to the second
Dr. Manojit.
edition. Yes. Is everything okay?
Yeah.
Right. Am I audible, Niranjan?
Yes, absolutely. Please go ahead. Yes.
A very good evening to one and all present here, and I would like to invite all present to the second edition. Yes. I think we're. Is everything okay?
Yeah.
Right. Am I audible, Niranjan?
Yes. Please go ahead. Yes.
A very good evening to one and all present here, and I would like to invite all present to the second edition. Yes. I think we're. Is everything okay? Is my voice repeating? Dr. Niranjan?
My audible, Ranjan? Yes. Please go ahead. Yes.
A very good evening to one and all present here, and I would like to invite all present to the second edition. Yes. I think we're. Yes, I think I figured out the problem.
UT was on. Okay. Anujit, was UT on?
Yes, I think the YouTube was on by mistake.
Please start.
So very good evening to one and all that are present here, and would like to invite you to the second edition of the Yosi IGO Livewire series, which is a collaboration by the Young Ophthalmological Society of India and Indian Journal of Ophthalmology. We had a first session 2 months ago on writing case reports, and we come to you today live with our second session, which is photo essays. It gives me immense pride, privilege, and pleasure to be able to invite our chief guest for this evening, Dr. Vanati Murugesan ma'am. Dr. Vanati M is a professor of ophthalmology, cornea, cataract, and refractive services at the All India Institute of Medical Sciences, New Delhi. She completed her MBBS from the prestigious Madras Medical College and a post-graduation, that is her MD in ophthalmology, from the Rajendra Prasad Center of Ophthalmic Sciences in New Delhi, following which she completed senior residency training in cataract, cornea, ocular surface, and refractive surgery from AIIMS New Delhi as well. It goes without saying that ma'am needs no introduction. She has numerous accolades to her name with national and international publications, as well as being hailed as a prolific teacher for both undergraduate and postgraduate ophthalmology. And she's currently the editor of the Indian Journal of Ophthalmology. Just to go ahead with the Yosi team, joining us today and for the last 2 years, we have our president, Dr. Sonal Kalia ma'am, our immediate past president, Dr. Digvijay Singh sir, our secretary, Dr. Secretary, Dr. Karan Bhatia sir, our vice president, Dr. Devakant Mishra sir, our treasurer, Dr. Avanish Upadhyay, and our joint secretary, Dr. Nilesh Kumar. This governing council is joined by an enthusiastic team of 20 executive members. The Yosi Journal Club has been active every year trying to improve the quality of presentations for Indian ophthalmologists, both in the country and abroad. Every month we have a topic that on a subspecialty that is chosen. So this has been going on since the year 2021, followed by 2022, as well as in 2023. In 2024, we conceptualized the Yosi Livewire, which was consented by Dr. Vanati ma'am, who we are very grateful for this opportunity. The team is currently led by myself and Dr. Niranjan Karthik. This was the first session on case report writing and all we needed to know regarding it. If you have missed this session, it is also available on YouTube. And that brings us to our second session for this evening, which is everything you need to know on writing photo essays. Before we go ahead, ma'am, I would just like to invite you to share a few words before we start our evening.
Thank you so much for the lovely introduction here. And it's always a privilege and honor and great pleasure to be among young ophthalmic minds here. And I think we have a very nice interactive academic session lined up here. So let me not waste more time, and we will delve into all the case presentation, and we have that interesting session of how you want to go about doing photo essays for publication. I think that's going to be the crux of today's discussions here. And thank you, the Yosi team, the Yosi executives, for having IGO on your portal here, and IGO is happy to be with you and take you all young ophthalmologists further in academic research writing. We'll move over to the academic platform.
Absolutely. Thank you so much, ma'am. With that, I'd like to invite Dr. Sunanda Haldar to share her case presentation. Dr. Sunanda Haldar completed her MBBS from the Medical College and Hospital, Kolkata, followed by her MS from the Regional Institute of Ophthalmology, and she's currently a consultant in cataract and glaucoma services at the ASMI Save the Sight Foundation in Kolkata. Dr. Sunanda, since you're having a bit of trouble, I am sharing your screen for you. So as and when you feel that you would want me to change the slide, please let me know. Dr. Sunanda, am I audible?
Yeah. May I start?
Yeah, you can go ahead. Yes, absolutely.
Okay. Good evening, everyone. Today I am going to present a very interesting topic, which is Duane retraction syndrome in a case of Hall-Torum syndrome. So, Hall-Torum syndrome is known as heart-hand syndrome with upper limb abnormalities and congenital heart lesions. It is an autosomal dominant disorder. It occurs due to mutation in TBX5 gene. Incidence of 1 in 1 lakh individuals, and it has no sex predilection. Next. So what is Duane retraction syndrome? It is a congenital eye movement disorder. It occurs due to misdirection of nerve fiber on eye muscles. It is a part of congenital cranial dysinnervation disorders. It results from an absent or dysplastic abducens motor neuron with aberrant innervations of lateral rectus muscle by oculomotor nerve. It can be unilateral or bilateral. So the chief complaints. Here, a 15-month male patient presented with lagophthalmus and exposure keratopathy in the right eye. There is limitation of movement of right eye in horizontal gaze abduction and with globe retraction in adduction. There is also associated redness and watering of right eye. So the ocular findings. So if we see the right eye, in both the right and left eye, the visual acuity, the patient is following light and object. In extraocular movement, the right eye is showing restricted in lateral gaze, abduction, and globe retraction in adduction, and the left eye is showing full and free direction in all gaze. If you see the eyelid, there is lagophthalmus in the right eye and the left eye is normal. In cornea, there is exposure keratopathy in the right eye and the left eye is clear. The lens in both the eyes it's clear and the fundus showing normal findings. Now the systemic findings. There is bilateral radial club hand with absent radius bone and absent thumb. There is absent right ear, anode ear, and there is also history of occipital encephalocele with hydrocephalus, and the patient is suffering from congenital heart disease of atrial septal defect and ventricular septal defect. Now the diagnosis part. The ocular findings are diagnosed by clinical examination and slit lamp examination. Both the X-ray of forearm and hand, AP and lateral view done, which is showing there is bilateral radial club hand and also there is absent radius bone and absent thumb. We have also done the echocardiogram with Doppler study, which has shown there is ventricular septal defect and atrial septal defect. Beta test is done, which is showing there in the right ear there is moderate to severe hearing loss, and in left ear it is showing normal. MRI brain was done which shown occipital encephalocele with hydrocephalus, and the sleep EEG showing normal findings. Now the treatment part. In ocular symptoms, the exposure keratopathy is treated with lubricant eye drop and gel and eyelid taping at night during sleep done. Repair of occipital encephalocele done by the ventriculoperitoneal shunt insertion with surgical excision. And the other problems like skeletal abnormalities, cardiac conditions, and other things is undergoing treatment in various specialties like orthopedic, plastic surgery, pediatric, and cardiology departments. So the differential diagnosis. It may be thrombocytopenia absent radius syndrome, heart hand syndrome type 2 and type 3, Duane radial ray syndrome, ulnar mammary syndrome, long term brachydactyly. Thank you.
So thank you so much, Dr. Sunanda. With that, I'd like to invite Dr. Kaushik Tripathi, sir, to just share his comments on this case presentation, what can be done for it to reach a state of publication, and what his experience was mentoring Dr. Sunanda over this presentation. Dr. Kaushik Tripathi completed his MBBS and then his MD from AIIMS New Delhi, followed by his DNB, his FRCS, his FAICU in retina and vitreous, and is currently a phaco, vitreoretina, UV, and ROP consultant at the ASGI hospital in Kolkata. Dr. Kaushik, could you share what your thoughts on this case?
Thanks, Yosi and IGO for having me here. So this was a nice presentation and it is definitely rare. So, and I think if we can present it adequately or properly, it can be accepted in a good index journal. So the challenges we had is that whenever a young ophthalmologist is trying to write something, I think please focus on the grammar, language, because spelling mistakes, capitalization, etc. These are important because these are the editor. When you submit a paper, it goes directly to the editor or editorial staff. So what they see is that they see the title and they see the abstract. In photo essay, there might not be any abstract, but the photo essay itself is so small, so they'll read. So make sure that there is no grammatical mistakes and language errors. So Grammarly, there is something called Grammarly.com, and they have this Google Chrome extension. It is available for free. I'll request all the young ophthalmologists to use that when you are submitting a paper and check all the spellings and all submissions for grammar. Other thing was that we had images, but the quality of images were not great. So whenever you are capturing something, whenever you are trying to take some pictures, try to be perfectionist at that, because the X-rays we had those, but they were not properly taken. So if you want to submit it in a quality journal, they'll want you to have very good quality images, which we do not have. So that is a challenge, and also in capturing a child's face is maybe difficult. So whenever you are trying to you take an image, try to take it perfectly. So this is very important. Whenever you are seeing a patient, if you want to present a fundus photo, anti-segment photo, try to get the best that can be available. And I think this Holtoram and Duane retractor syndrome, their association has been reported before, but because this is a rare association, Dr. Sunanda, you can definitely try to publish it. So my suggestions will be learn Grammarly, and also if you are trying to write a large manuscript, learn Zotero to use for referencing. Thank you.
Right. Thank you so much, Kaushik. Vanati ma'am, would you like to add some comments?
Yes, yeah. Can you hear me? Yeah, I hope I'm audible. Yes. I think that was a very interesting and a rare case to present here. But when you're considering to translate it into a research publication, first, as Kaushik rightly pointed out, you need to write it out in good, simple English. Just remember, you don't need to have a flowery English, but just simple, good English. And if the shorter the reports, the more likely the chance that the top people in the editorial board are going to be reading it right away. Okay, so you really need to create an impression with the way you're writing. You don't need it to be flowery. You'll have to remember that you just need to know that the language is written properly. Even simple Word document, it always, underlines in red wherever you're going wrong. And now the latest versions give you very good alternatives for what you're writing. They give you good suggestions and your spelling mistakes, all these are corrected. So if those are not corrected, and whenever the editor is looking at it or the editorial staff is looking at it, they right away know through what levels of research writing has this gone through. Sometimes it's a very base level, entry level postgraduate who's writing it, whose knowledge in English or knowledge in framing or whose knowledge of putting ophthalmic sentences correctly is not there. And then only you know that your senior has not mentored you in the writing here. So these faults are to be, really corrected, that at least you, when you're writing, get your senior author to sit and look at it, spend some time, especially if you're a beginner, spend some time and see the way you are narrating your ophthalmic history, the way you are, relating the sequence of events. They're all in proper order. And I would really recommend that you also read up a lot of ophthalmic literature. That's the way that when you read up ophthalmic literature, you automatically, it's something like, practicing singing. So once you keep reading, you know that this is how you will have to write your literature here. And that's a very simple, that's the next tip which I would like to give you. Use Grammarly if you feel you need to enhance and you feel you're probably not so confident about your grammar. Then that's a nice way of, correcting it out as well. But it's not really required that you need to put it through Grammarly all the time here. Again, the next you go into the technical aspects first. So first you've got your writing correct. Next, your title. Again, please don't give titles like you're giving conference titles. So something when you're speaking for conferences needs to be flowery and when you're attractive. When you're writing a title, it needs to be dot on what you're talking about. Because, for example, I'm doing a literature search on say Duanes. It should appear on the literature. Suppose you just give on something very flowery and it's not relating to your Duanes, then people are not going to be looking at it or reading it. That's another one. And again, your keywords should also be there so that anybody who's searching for the particular will be able to look at your article here. That's true here. Please read the author's guidelines and stick to the guidelines when you're forming. So if your case report is, for example, going to be 1,000 words, 1,200, there's no point writing something which is, much less in just 500 words or writing something which is 3,000 words. Again, please look at the format of references you need to, and please only choose those references which are absolutely apt for your article. So citation, learning to cite is also very important here. Introduction should be very apt to the particular case you're discussing, and don't take your discussion into a general didactic discussion. Discuss the relevant ophthalmic features of your particular case. What is the rarity in your case which you want to share with your audience? And what is the learning message you're giving across to your audience? The case might be rare, that alone does not, again, only if it's the first case report in the world will it then the rarity come into it. The second case report is not as important as the first one. So you'll have to remember that they will just say it's a repetition. What are you giving more? I mean, if you're running a journal, you will also say the same, that, because you are in the business of publishing and you are in the business of wanting your journal to run the race and be on the top. So every page and every space which I'm lending out has to get me a citation. That's how IGO can be on the top when it's viewed by people here. So you'll have to remember that, and you have to write it in such a way that the editor finds it hard to refuse it. Even if you find that it's probably a second or the third case report, and add on new images. And again, a good habit is that please photograph. I know photography is not as difficult as it used to be during my residency days. I think everybody has photographs here, and it's just, that extra incentive which you'll have to put into yourself to photograph your cases and keep them ready. And I find it a very nice way. It's not just for publishing also, even when you're making presentations across a case series of a particular thing, your presentation really goes across very nicely if you have documented and if you have imaging documenting your case here. So these are simple ways, simple tips which I can give you, and start from there. And then perhaps as you go into the exercise of publishing, you will learn more.
Thank you so much, ma'am. So one question that comes in from this is, Dr. Kaushik also mentioned using Grammarly, and then you cited that with him. So now Grammarly has an AI corrective tool as well. And when we go into AI, there are a lot of AI chatbots which now can
Yes.
take points if we exactly take her title and can create something. And there have been reports of some publications where they've cited AI as an author as well. So, ma'am, could you just share your take on this?
I think,
Editor as
yes.
well as
All international research peer-reviewed publications, if you're using an AI tool, now I think more and more all publications are going to have AI detecting softwares in them. So if they do detect that there is an AI software in it, I believe it is not going to be considered. You have to be human authors here. So, and again, when somebody's language is so exceptionally true, exceptionally good, then the author editor knows that there has been an artificial intelligence interface which has perfected this here. So that's an aspect here, and we do have a lot of images now. I do see them submitted for IGO, which are, you know, artificial intelligence generated here, and mind you that we can pick it up here. And once the query is raised, even a doubt, even a speck of doubt, it's enough for the editor to refuse your publication. So that's how, because we get so many papers here. So we just need a reason that, you know, if it is something not really unique or not really exclusive, we just need one reason to say, okay, so if we know that it's an AI generator, and shortly IGO will also be adopting an AI detecting software soon, so that we will also be in line with other international journals here. So if you're having your publication, if you're having your research writing totally artificial intelligence engineered, it's not going to be accepted here.
well. Right. Thank you so much, ma'am. With that, I think we'll move on to the second half of the discussion. I'd like to hand over the mic to Dr. Niranjan. Dr. Niranjan, would you like to share your screen?
Am I audible, Dr. Anujit?
Yeah, you are.
My screen visible?
Yes.
Great. Good evening to one and all. I am Niranjan, Dr. Niranjan. So I'll be taking over the session for the second half for today. So we've gotten some really good tips and hacks from none other than the very editor of Indian Journal of Ophthalmology. So I think that itself brings us a lot of things to take home from today. Next up, we have two of our experts from IJO who are here with us this evening to share their pearls on certain topics related to photo essays. At first, I would like to invite Dr. Nawasi Sheikh, ma'am. So, once.
Dr. Niranjan, your presentation isn't moving. Yes.
So, Dr. Nawasi Sheikh, ma'am, is a senior research fellow at the reputed Institute of Dr. R.P. Center of Ophthalmic Sciences, New Delhi. I welcome you, ma'am, for today's session. Ma'am is here today to talk to us on understanding the importance and relevance and the role of photo essays in today's publication.
Good evening, everyone. So I'd like to first begin by wishing everyone a very happy Eid. So am I audible and is my screen visible?
Absolutely, ma'am. Please go ahead.
So I'm Dr. Nawaz Sheikh, and I'll be just talking upon understanding the relevance and role of photo essays, especially in today's era. So a picture is worth 1,000 words is an age-old adage that was first introduced by Mr. Arthur Brisbane, who was one of the most famous journalists of the 20th century. And it applies so well to ophthalmology because we can visualize almost all our pathologies through transparent tissues, whether it's visualizing corneal dystrophies, whether it's visualizing pathologies in the lens, or whether it's visualizing pathologies in the retina. As you can see in the first image, there's presence of a subretinal cysticercosis. We can visualize this. Presence of a cherry red spot in patient of central retinal artery occlusion. We can visualize it. Presence of lens subluxation. Again, we can visualize it, as well as take an image to be shared amongst our peers for dissemination of any information that is required. So what is a photo essay basically. So a photo essay is basically, it can either be a single image or a collage of images that succinctly describes a specific sign, a diagnosis, or a specific management pearl. So it could be just a single image, such as this case, in which there's presence of sectoral iris hyperpigmentation, or a collage of images of the same patient in which the central theme remains presence of iris as well as choroidal hypopigmentation associated with its clinical image, such that we can come to a differential diagnosis or reach a diagnosis when taken together along with its composition or along with its text material. Moving on, what was the history of photo essays in ophthalmology? So the first of photo essay that came in ophthalmology was in the archives of ophthalmology in 1964, where they initially introduced it as a feature photo. One of the first photo essays was this retinopathy with dermatomyositis. So a photo essay need not be a very rare case report. It could be something normal, such as the retinal findings in a patient with dermatomyositis, although which has been described multiple times in literature. The image itself leaves us with a visual feedback. So you see this image, you think about the differentials of these images using a photo essay. So what they had advised in their first feature photo was that they were basically printing archives of ophthalmology, and they had said that readers could ensure that they store these images for their further reference and for their further review later on. Then this worked on for some 11 years, and unfortunately it was discontinued by Archives of Ophthalmology after 11 years, but they reintroduced it specifically as an ophthalmic photo essay in 1986. After that, almost all journals have a small section on photo essays. They may have limited slots, but it's present in almost all journals, including IJO, which introduced it in 2012. And now, following that, they have IGO case reports, which is specifically designated to photo essays and case reports. So what are the components of a photo essay? There are 4 important components of a photo essay. The title, as ma'am said, the title has to be captivating but scientific, and it should be relevant to the central theme. So if I show you this image, I can easily title it an island of retina in a sea of oil. Yes, it's captivating, but is it scientific? Am I able to explain what you are actually seeing in this image? No, you're not. So I would rather call it extensive relaxing retinectomies in a patient undergoing vitreoretinal surgery for rhegmatogenous retinal detachment. So when you look for the keywords, you can find my photo essay as well as understand in just a simple line what is it about. The second part is an image. The image has to be a high resolution, well focused, as well as highlight the area of interest, such as in this case. So this was a 3-year-old child of retinopathy of prematurity who underwent laser for zone 2 posterior stage 3 ROP. If I'm talking about the findings of glaucoma in this patient, I cannot use an ultra wide field image such as this. Yes, I can see the periphery well lasered, but I cannot comment on the disc status. So yes, I need to magnify, make it into a collage such that this area is highlighted in a well-focused, bright image. The next comes the text part of it. So the text not only gives us the background, but it has to be concise and crisp as well as highlight your point of interest. And every journal has different word limits. Every journal has a different way of writing it. Like of pictures and perspectives on ophthalmology, retina has a word limit of 100 words. So you have to convey your thought just through 100 words. Whereas IGO sticks to the 300 word limit, whereas BMJ may allow you to go up to 500 words, depending upon whichever journal you decide to publish in. And the last part is the caption or the figure legend part of it. So the figure legend is a standalone statement. It should be such that you can understand the image just through the figure legend itself. So how do you create a good photo essay? So you have to decide on a central theme, such as this image. The central theme for this image was Fuchs heterochromic iridocyclitis. And with some experience and a lot of luck, you might be able to pick up what images, even with regular findings, you can translate into a photo essay. You have to use an image in such a way that you can put across the specific sign, the diagnosis, or whatever feature you want them to understand, such as in this case, it was the presence of iris nodules in patients with Fuchs heterochromic iridocyclitis. So as you can see, the images are in such a way that the first two images are basically highlighting the presence of heterochromia in a single eye in a patient. And the second is the magnified image, which highlights the iris nodules in these patients. Iris nodules by no chance are uncommon in these patients, and they are seen in up to 20%. However, once you highlight them in such a way, as well as attach a good composition and a figure legend to it, there's a very high chance that your photo essay may be accepted. Yes, you need to have some amount of research into the topic to be able to publish it. Another two cases that I would like to show would be, it could be something as simple as presence of choroidal folds in a patient with high hypermetropia. We know that choroidal folds can occur in them, but using multimodal imaging, we can not only leave a lasting visual impact in these patients, but it can help the younger generation understand that there can be other differentials to it. Second case is something known as the peripapillary venous loops, which are common. They are normal physiological changes that may occur. But using these images with the multimodal imaging attached with it, it leaves a lasting impact, and the learning improves for the younger generation. So what are the difference between a photo essay versus case reports? So case reports usually consists of an introduction, details of the patient, discussion, and it's usually about what is new. What are you adding to the existing literature? You might, although like ma'am mentioned, the first case report of a very rare case is the one that is important. But if you're adding to literature with your case report, it has a higher chance of being accepted. Whereas a photo essay can be something which is a normal clinical finding, but when it's demonstrated in a good, clear, focused image, it adds to the learning for a person. And you do not need an extensive literature review, a limited literature review to understand what was the cause for that sign, or how was that diagnosis reached, or what investigative modality helped you reach that diagnosis is enough for a photo essay. So for example, this image, so I can use it as a photo essay by saying macular hole in presence of gyrate atrophy. But if I want to publish it as a case report, I would need to attach what intervention was done, how did the patient present, how did I come to the diagnosis, as well as do an extensive literature review to understand why my case is different from what has been published previously in literature. Lastly, why should you choose IGO case reports? So any journal that you apply to usually has very limited slots. It's usually one per issue. Thankfully, IGO case reports, being the sister journal to IGO, has an entire journal dedicated specifically to photo essays and case reports. Our audience base is massive. We have the same reviewers as the IGO, and under the leadership of Professor Vanati, as well as the magnanimous efforts done by the previous editors, we're in the hope that this will be indexed very soon. So we would like all of you, all the young people out there to submit good images focused on a specific finding to IGO case reports for consideration. Thank you.
Thank you, Dr. Nawaz, ma'am. Eid Mubarak to you as well. And thank you so much for all the wonderful pearls and tips for how to construct and design a photo essay. So we have a few questions in the chat box from the hot seat participants. Anil, can we go ahead with a couple of questions before the next session, or should we take it up at the end?
I think we can take it up at the end as a complete discussion. We can go ahead with Sir joined in.
Well, in that case, it is my honor and privilege to invite none other than Dr. Sabyasachi Sengupta, sir. So just a second before I share this. Is my screen visible?
Yes, it is.
Right.
I think, yeah,
so
absolutely.
It is my privilege to introduce you all our very own associate editor of IJO, Dr. Sabyasachi Sengupta, sir. So, sir is a very famous person as far as the research and methodologies go, and his workshops speak for themselves as well. So, sir has many accolades to his name and many credits and honors. But here I've tried to concise it to those relevant to our area of interest today. So, sir has gone on to do a postdoctoral research fellowship at Wilmer Eye Institute of Johns Hopkins, USA, University of School of Medicine from USA. And specifically, he has done a one-year course in biostatistics at Bloomberg School of Public Health, Johns Hopkins. So we welcome you, sir, and we are very, very happy to have you with us. Are you able to log in, sir?
Sir is there. Sir is there. Yes,
Yeah,
he's there.
yeah, just give me a minute.
Yeah, you can see you.
Dr. Niranjan, you can unshare your screen.
Yes. So today we have sir with us to share his thoughts on how to target the right journals to publish the photo essays. Over to you, sir.
That's why I need to share my screen.
I will just make you a co-host, sir, because you
Yeah.
joined in the end. Yeah. Are you able to share your screen now?
1 second. Yes, I am.
Yes. Okay.
So I'll quickly share a couple of things that I have learned along the way when I have started writing case reports. And so quickly, I'll share a little bit of a roadmap with you, which it'll relatively resonate well with you, and then you can actually choose whether you want to write a case report or an entire case, a series, or perhaps shrink it down to an ophthalmic image or a photo essay. This is essentially what most of our patients come with, right? So what we do in the beginning, we ask about what is the symptomatology, past any relevant history like diabetes and other things, and then we concentrate on the current illness. So you document that with dates, then you do your physical examination, slit lamp imaging, whatever, and you come to a diagnosis, and then you initiate treatment, right? So what you then do is, either you refer to somebody or you actually start treating, and then there are ongoing interventions and follow-ups over a period of time, and then there is a final follow-up, and then there is either a resolution of the case or, perhaps there is a bad outcome, which is also sometimes possible. So this is essentially a roadmap, right? So, I mean, all of us are obviously aware of this since day one of medicine, right? So how do you use this and decide what you're really going to do? So what if you are looking at something which is only interest to others, where the physical examination and other diagnostic techniques are concerned? Just 1 second. Right. So what if only this is of interest to others? Perhaps the diagnosis is a routine one. The treatment is all routine, and there is not much interest going to be in that. So this is really based on your diagnostic methods, right? It could be an image, or could be a PCR test that you've done, or whatever that may be. So this really qualifies as an ophthalmic image, right? Where you just write a legend, isn't it? So this is like figure 1, and it shows XYZ, and that's about it, right? So this is mainly imaging based, at least in ophthalmology, right? So this is where you think about writing an ophthalmic image, which is, say, a less than 100-word submission to a journal, right? So this is where you look at an image, and this is an image which I had published in JAMA Ophthalmology, and this is, it is called ophthalmic images in JAMA Ophthalmology at the time. Now it is called photo essays in JAMA Ophthalmology. And so this is just the image. This is a combined branch retinal artery and branch retinal vein occlusion. As you can see, there is total lack of perfusion here, and then there is cattle tracking of the artery and all of those other findings. So this is a combined BRAO and BRVO, which is not at all common, and so this was published as an ophthalmic image. However, I don't really need to say that we did an FA and this showed that, and we did anti-VEGF and etc. We did laser. That is not not going to be of interest to people. So this was just an image. What if more is of interest to people? How you went and diagnosed that thing? How do you look at there were these differentials, and we went and we did this, and then we reached to a particular diagnosis. And that is when you have to write slightly more, right? Perhaps 100 words is not going to be sufficient, and therefore maybe the treatment is not going to be of interest to people because it's just like any other case. So here is when you want to write slightly more, right? You want to discuss more differentials. So now you think about writing more, and perhaps photo essay will suit your needs, where you have about 100-word, about a 300-word limit in most journals. And suppose you want to write the entire thing. Let me go back. So suppose you want to write the entire thing where you think that the treatment was also. So where you think the treatment is also important, and you did something which was out of the blue, and something which is going to be of interest to the readership, then you write the whole thing, and that could be a case report entirely, right? Where you start from, this is what it was. There was a diagnostic problem. We diagnosed it. We did these tests, and then we treated it again differently from what you expect. So, that is the whole package. So this is, qualifies as a case report. If you have more than one patient, if you have 4 or 5 perhaps, then you can think about putting them all together. So this was a vitiligo iridis, where there are these atrophic spots on the iris, and that is indicative of glaucoma in the back, and that is a sequelae of smallpox, which is of course now eradicated. But then these are patients all who were relatively old. So if you can wait on and hold on and then actually show causality, that helps. So then you can perhaps post more patients together, and so then document every patient. And one patient may not cut it, but then when you see 4 or 5, and then you may say, this makes more sense, right? So that helps. If you have 6 or more, you can always think about making it an original article. Like this is a combined vascular occlusion, which I actually had written one case before. Now I started seeing more and more, and it started accumulating. And then when I had 6 cases, then I wrote this as an original article. It got published as an original article. Another original article of 8 cases. So this is Bacillus cereus endophthalmitis mimicking toxic anti-segment syndrome, where there was a lot of destructive pathology because of this organism in a post-cataract surgery endophthalmitis, which happened within 12 hours of surgery, and patient lost the eye by 24 hours. It was so pathogenic. So so putting rare cases in larger numbers can also get. So this was published in Ophthalmology Journal, right? So that is the biggest journal we have today. So if you can hold your horses and perhaps collect slightly more number of cases, your chances of getting into better journals with not just a photo essay, but even sometimes an original article can also happen. Right. So I think you've gone over these things. So this is another. This was taken actually with the mobile phone. Right. And this is a subconjunctival cysticercosis which just popped out, the person. So this is Karan Bhatia. So he was actually in the OPD, and he just saw there's something pouting, and he just raised the lid, and this just fell out. As you can see, this is how it is. So it was confirmed to be a cysticercosis. So whatever you have, if you don't have an imaging modality like a photo slit lamp, you can always use your mobile phones. And so this was published actually in JAMA Ophthalmology as an ophthalmic image, right? So so these are some of the ways which you can do. I'll quickly skip on to I'll just show you. This is journal choice. I want to show you some examples of ophthalmic images in New England Journal of Medicine. That is like the biggest journal we have, right? So this is 2020, and as you can see, this is so what they call it is an image challenge. They don't call it a photo essay. When you go to submit, you will see categories of submissions. This is the New England Journal of Medicine, right? This is an impact factor of more than 50. So this is the best journal. However, they also publish photo essays. They call it image challenge. You need to sort of word it slightly differently. So the top journals also take these kind of submissions. Let me show you some more. Just 1 second. Yeah. So this is the New England Journal of Medicine. Lancet takes, I told you about JAMA Ophthalmology. Ophthalmology calls it pictures and perspectives. Let me quickly, yeah. So, these journals call it differently. They don't call it a case report. They don't call it a photo essay, but, all of them take these, right? All of them take these. So it's really important for us to know that almost every top journal takes these kind of submissions, but they just don't call it the routine name. So once you go to the, instruction to authors page, you'll realize that all of these, because we're talking about journal choice, you should know that almost all of the journals do take case reports. Just 1 second. Huh? 1 second. Sorry about that. Yeah. There is one more slide which I thought I'll show you. Yeah. So these are some journal finders. So this is Web of Science Journal Finder. I'll show you that website. Where you actually have to do, what you have to do here is, just say, have a manuscript, say match manuscript. You need to log in. I'll just quickly log in. That's why I'll use my Google login. You're able to see my slide, right? I mean, you are able to see my screen.
Yes, absolutely. So everything is visible.
Okay, so this is how these look like. So this is from Clarivate Analytics. This is the one which maintains the Web of Science, and this is the one which gives the impact factor, right? So this is the manuscript matcher. It asks for a title and an abstract. Remember that many journals take photo essays without abstracts, but still, you need to write something about it. So I have just opened up one of those. Let me quickly show you. Yeah, so this is a sample case report. This is of course already published, but I'm just, this is the title is retained intraocular foreign body presenting with acute retinal necrosis. So I'm just going to copy, and you need to put your title. So you need to construct the title well. Remember that all of your keywords should be part of the title. Only then will this be able to match it better. And then they want you to copy paste your abstract. So one second, I'll just copy paste the abstract. So not important what content is there, but then you need to write the abstract relatively well, right? I just copy pasted that, and you just say find journals. So it's taking its time. It's going to find journals. So this says Journal of Clinical Medicine. Then it says Medicine, Biomedical Research International, Graphies Archives, Clinical Experiment in Ophthalmology, Indian Journal of Ophthalmology. So these are all the International Ophthalmology, Journal of Ophthalmology. So these are all the options this is giving. Then there are others like Elsevier also have their own journal finder. Quickly, I'll show you that also. So this is where they just quickly want you to enter your abstract. So you just copy paste that and just say find journals, and it will give you some. So first it says American Journal of Ophthalmology case reports. Remember, this is going to only show journals which are within the Elsevier, within the Elsevier umbrella. So this talks about Journal of American Academy of Pediatric Ophthalmology and Strabismus, some other. This is Spanish Journal, Journal of Pediatric Surgery case reports. So it just gives you information. That you will uncover journals which are, which you may not have even heard of before. So there are some journal matches. Nature has one, American Journal Experts. These also have. So you can try out some of these journal matches, or you can just Google the name of the publisher and journal finder. So you can see Nature Journal Finder or Elsevier Journal Finder, Web of Science Journal Finder, and then you will get things to sort of work with. So I think I thought I'll share some of these with you, and yeah. So I thought this would be good enough to sort of use AI. Basically, these are all artificial intelligence based search engines which are helping us zoom into some of the journals that you could choose. And also remember that most of the top journals do take some of these case reports. The shorter, the better for them, right? Because these are good to read. I've said this before also, that these are good to read. They don't have abstracts. They have maybe one or two images, and they don't therefore qualify as citable images or citable items, and therefore they don't impact the impact factor, right? So therefore journals are very happy to take these, publish them only online. They bring in the readership, but then they don't impact the impact factor. So therefore these journals have cut it down, but still retain that essential quality of a case report. Yeah,
Right.
that's
Thank you so much, sir. I think you've just given us a treasure trove of information and resources in just 10 minutes for a lot of young ophthalmologists to just go and hunt. We have some participants in our hot seat who asked some questions. So some of them have been answered, but I'll just read them out so for the benefit of those watching this later as well. So Dr. Remya Rajan asked that, can we present a case series in a photo essay, ma'am? Dr. Vanati, ma'am, would you like to take this up?
See, when you look at the journal instructions, it gives you restrictions on the number of images which can be given on a photo essay or on ophthalmic images. So, for example, if you're having when you have to call it a case series, you will need at least 3 or more cases. So it would be a little difficult to accommodate, if you have even 3 case series, and putting in too much of collage onto a photo essay diminishes the focus and the impact your images are going to create on for it. But then if you feel that that's really going to add on to the message which you are conveying, then it's fine. But as Navasish rightly showed, and as Sunny also showed, if you need to have a crux image which is giving you the entire message, and you just have something about, say, 500 or 1,000 words max with which you can give your message to the readers. So when you are occupying so many images, your figure legend itself will be running into so much. So all those things will have to mix and match. And if you have a case series, and as Dr. Sunny nicely showed that, his bacillus and ophthalmitis cases, it's a series, it's something new, it's a learning message, and it's alerting the audience that this can also occur after your surgical interventions. So that's what you need to highlight, and not just think I have a case series and I'm just going to show all these photographs. Your photograph also needs to be exclusive and unique. That's what is going to be captivating, and it should be giving you a message.
Right. Thank you so much, ma'am. So one question has been asked by Dr. Nivedha. So may I know then if you have any limitations to the number of photos per case, ma'am? So I think she means for case reports, photo essays, and whether composite photos and ophthalmic images. I think she means that.
Yeah, I think each of the journal defines what each figure, how many composite figures can you mix up, of how much of a collage you can make. So IGO currently is allowing 6 to 8 in a collage here, but we are going to be revising this. You could still put a 6 to 8 collage, but your charges are going to go higher, because every journal, when it's printing, it's going to calculate its cost depending upon the number of color images which are figuring in the particular. That's one of the factors by which the costing is calculated. And our publishers have also increased the rates for IGO publishing. So every year it does go about, the cost of living is changing, your value of money is going down. So IGO cannot be doing everything free of cost. But please remember, the rates which IGO offering is the most competitive. It's the least possible among all the other journals which are offering you case report publishing here, if you look at it that way here. So we are also probably going to revise. You could use, I think we have 6 or 8 depending upon the categories you're putting in, and the instructions are very nicely laid out by, I think Sabyasachi was the one who laid out those instructions on during those terms. They are fantastic. We don't see the need to revise them here, but the costing is probably going to go up high, because I do find we do extend a lot of advantages to our younger ophthalmologists, but they also tend to abuse the privileges which have been extended onto them. And they try to squeeze in and put all the images. For example, if you're showing me a clinical case, the clinical signs and the diagnostic images get mixed. And then for a learning person, it's confusing. So if you're otherwise going to, for example, for fundus pictures, you have a fundus photograph and you have a multimodal imaging side by side, that corroborates. But then if you're having an anterior segment imaging and you're putting in a diagnostic imaging onto the same, which doesn't really match, and that you're doing really only to do away with the costing, you don't want to pay the 2,000 rupees extra, then it really does not gel down well as well. So by and large, you will have to look at it. It's not a bracket rule, but then it is a rule which has to be custom applied to the kind of case and the kind of presentation you're making here. That's my message, which I'm giving to you.
Ma'am, there is one more question for you. Can you suggest some apps for making photo essays?
The human brain is the best app.
Yes.
Yes.
I think on
So
yes, on
please go ahead.
PowerPoint only you can just divide it and paste it.
Absolutely. I mean, if you want to know the layout of how, I mean, Adobe has it's very easy to use here, and it's now freely. It's not as difficult as in our days. We had to buy a CD, we had to load it up. Now it's all available on free. You can use it in 3 devices, 5 devices here. And then it does help you to make your images. Even your Mac imagings, they all really help you. Your Keynote also has good ways of compiling here. PowerPoint is a very effective way of compiling your images as well. And even if you find it difficult, you need not put it into a collage. You can just name it into A, B, and C. The publisher itself, they have very sophisticated softwares, and they also can compile it for you if they're putting it across. And please remember, when you're putting it across, watch the resolutions in which you're putting in and the resolutions in which you're saving, because that ultimately is going to make an impact when the editor is looking at the images here. And when you're looking at ophthalmic images and photo images, the quality of your images needs to be really good here, because that's going to give an impact. The way you are assembling it and the way you are going about writing, your brain is the one which is going to be the app in that.
Very well put, sir. Sabyasachi, sir, would you like to add a point to that? regarding tech and tools, any suggestions?
There are some case report writers, and then but they essentially ask all the information from you only. So they don't really, so there is a
Yes.
care case report writer.
Yeah.
Let me try and see if I can pull it up.
Care guidelines for writing a case
There is
report.
a care guidelines for writing and gives
Yeah.
you a template. And what you can do is once you have a template, and in fact, we are now sort of revising the IGO author guidelines as well. And this, if I remember, if you recall, Dr. Sabyasachi, you did suggest that we put in templates. So we are sort of making it easy for the novice writers or the beginners who are writing, so that they know these are going to be the subheads. And you will know that the next subhead is going to have so many words, so you just put in your text out over there. So those are just guidelines for you here, and I would recommend that you go and read the care reports, the reporting guidelines here. And as we are going to go into indexing, that's going to be something very important which the indexing agency is going to look at. I think Sabyasachi is aware of the drawbacks because of which the IJOCR was not accepted for indexing during your term. So we are working on that, and we do find when we enforce these rules on our contributors, they do get a little, a little annoyed that we are being too strict with them. But these are all international norms and protocols which one has to follow when you are reporting, be it cases, single cases, be it series, or be it images.
Right.
Yes, Sabyasachi, you were showing us something.
Yeah, let me try and share my screen quickly. I mean, I don't think this is really going to help tremendously.
Yes.
But, yeah, let me share my screen. Okay, so this is called the care. There are two writers. One is the AGO case report software, and it's not that great. So this care writer, the people who actually came up with the care software, so you need to log in again. Let me just quickly log in. Yeah, so this is again free login. Okay, so so this, you will see a dashboard, and you can actually say new case, and it'll ask you a lot of information and all of this. So let me show you one that I have already done. So this is how it looks like, where you enter authors and then you enter the abstract, and then it asks you about introduction and all of that, and then it asks you about narrative, patient perspective, discussion, conclusion, acknowledgement, references, and something like this. So essentially it's not doing anything for you. It's just asking you to combine all
Yes.
your data in a particular way. But
Hmm.
this is what the care guidelines state, so where there's a lot of things in this are part of the care guidelines, right? So this is, there is something on diagnostics, on which day you did what. You can actually enter this date and OCT and these are the findings, and then it'll actually automatically sometimes so here if you see, I have written on this was a history, and peripheral retina 360-degree was normal, ultrasound was performed, this and these are things that were seen. So you can actually enter them in these diagnostics and save, and then it'll actually auto populate them in wordings for you. And there are some of the, again, some of the timelines. So this day this is the finding, this day this was the finding, so something like that, and then you can actually preview it, right? So I'm actually showing you the preview. So this is some non-negotiables which have to be there. So so there has to be a discussion, but then not necessary for a photo essay, but if for a whole case report. Nowadays people are asking for patient perspectives as to what patient felt, and did they see better, or did they feel any improvement and things like that. And so so this is something which is now there. This is called the care writer. You can actually just explore more on it. So I thought I'll quickly show you, but then I don't think this is really necessary in terms of how it will help you enhance your writing. It will just tell you that, oh, these are some of the things which need to be part of your. So look at, do I have a discussion? Oh, I don't. But then the journal doesn't want it, so then there's no point in writing. So if you're actually talking about photo essays, you don't need it. But if you're writing a case report, then you could use this and generate the whole report like that.
Yeah, I think.
So
Can I
I
just
have,
add on quickly
yeah,
something
absolutely.
shortly? Yeah, it's just as a sort of a guideline. I think, for example, when Netasudil came in and Netasudil was being used, and we had a lot of macrocellular edema, which we are seeing in those corneas. And when we first saw it, it was quite puzzling. And as a cornea expert, I was brought in those initial cases here. And then when we did see a case, see that did not have anything much to write about as that, but metastudil, when you use in decompromised endotheliums in the presence of raised pressures, is going to precipitate macular cellular edema. So it was Shika and me, we just put in the photo image and we just wrote about it. It hardly took us half an hour or more to write it out here. And we were 3 authors, and it goes chatpat into the journal because it's novel, it's new, and the image capture was really very good here. So that is what we are looking at. I think that's the crux, is that that's what just a photo essay or an image can fetch you an indexed publication when you're reporting something new here, and you don't have to spend a lot of time writing it. So that's said and done for people, and that's so it's easy for us because we've been doing a lot of things down the line. It's easy for us to pick it up. But the best way for all of you young ophthalmologists is please spend some time every week or every month. We used to have a journal day when we were all training as residents here. We used to have, say, 2 or 3 hours in a particular week following our clinical rounds, which used to precede our OT days, where we used to go to the library those days and read, because we didn't have so much of online access here. And we did look at a lot of journals. We kept reading them, and that sort of gave us a mental impression of what should follow what when you're writing down the sequence of writing here. Nowadays, I think since with the free availability of everything online, that habit of visiting the library or sitting down to read, and I think more and more of young people would like to spend their screen time on entertainment and social interactions rather than academic interactions. So do make it or sort of incorporate into your protocols some fixed time of every week or every fortnight as what suits you, to look into how research writing can be done. And that's a way of learning, and that really makes your writing very easy. Because once you know how a thing, it's something like driving. Once you know the route to reach a particular place, then you just do it effortlessly, and it just comes subconsciously, it happens. And that's the best way, and that's how you will really enjoy research writing, rather than thinking. Otherwise, it's going to be the other way around. It would be as bad as doing your thesis writing, because that's the first research writing which all of us take up, and we always look at it in the initial phases that this is very burdensome. But when I look back, I think I never spent so much of time researching how to write a good paper as I did when I did for my thesis here. So it's a message which I really like and encourage all the young ophthalmologists to follow this.
Thank you so much, ma'am. I think this is a really important nugget to take home, more so than either of the presentations that have been coming across. So one question that I have, ma'am, is that often when we come across and we submit a case report and there is not a tangible finding or a tangible outcome or a tangible intervention, sometimes a journal, sometimes IJ also has returned the case report saying that this would be better suited as a photo essay. So sometimes is this the photo essay taken as a substitute for case reports when a tangible outcome is not found, or is that the suggestion from a journal to the author once as a substitute because there's not enough information for a case report?
See, several times as an editor, I have to make certain decisions that a case report is not giving a novel message, and it's not actually adding on. But then if I find the images are very nice, the images are, and I still feel, I mean, I didn't look at IGOCR so much as I'm looking at it now, and at the depth at which it's looking, I think it's each issue, if Sabyasachi would agree with me, has something like 150 clinical scenarios compiled into that 300 odd pages. And it's like a power capsule of ophthalmology, not only of a particular specialty, but it's nice that it's a potpourri of almost all specialties. And if people really look at it, there's a lot of learning which goes into it as well. So when I find there's nothing novel in the case report, but I find the images are good, and I would really like to encourage the resident or the postgraduate who's writing it. And I think if this warrants, and I would like to give an opportunity, instead of saying an absolute no to them, would like to give them where they occupy a little lesser, and they can write with a particular focus, picking up on their image, and it's a very short writing. So that way it's form of an encouragement rather than just say no. But it is not necessarily that, I'm substituting it here. The image has to be good here. And the way you write it up when you're converting it into a photo essay, it's not that it's going to be easy. It's going to be just as tough. but then it's also an extended opportunity where all the reviewers had said there's nothing new, please reject it. And please remember, I will have to go back to these reviewers for reviewing more of my articles here. And if I do not value their advice all the time, they're going to get at me although every time they're not, and the work of IGO is not going to. So it's going to be a sort of an able mix of how I mix and match here, and it also lies on a large amount of it centers around the merit of your research writing and the images which you're producing to us.
Right. Thank you so much, ma'am. We've had a lively discussion. I would like to invite Dr. Sonal Kalia, madam, to share her closing remarks for today's webinar.
So, first of all, at the outset, I would like to apologize to everyone for being tardy. I was traveling and I could reach a little late today. I'm so sorry for that. So, not just closing remarks, I also have to give the vote of thanks here. So, Team Yosi is grateful to AIOS and Team IGO for this fruitful collaboration. And I hope that young ophthalmologists are going to ultimately benefit not just by joining live, but also the recorded sessions, because they are going to be tiny capsules which will give, the brief information and the detail wherever they need to know the details, because so many doubts are being answered as well here. Respected Professor Vanathi ma'am has been kind enough to join us despite returning from Boston 20 odd hours ago. So thank you so much, ma'am, for that. And not just that we all know her expertise, it's just that she summarized the points, so the pertinent points at the beginning, and answered all the queries so patiently. I'm so grateful for that, ma'am. And the way in which, you reminded the digital age bios that it's important to read journals, set aside time for that, because what actually happens is that you end up reading something on your mobile, even if it's a journal that you're trying to read, or you're even trying to work on something of your own for a particular submission. And in between a call comes, in between some message comes, and you get distracted. So the setting aside time and going and actually reading on paper is something that you've really, hit the point on and reminded everyone they're going to really benefit from it. I hope so that. And next, Yosi Singh Gupta sir has been one of those, very zealous people about research, and he has been relentlessly guiding so many young ophthalmologists, for which so many of us are thankful. And today also he's shown so many things live to us, and how to log in and take help from different type of softwares. That's something where you learn from the master kind of point. Those points nobody else can really show you. And Dr. Nawazish was so eloquent in sharing the details of not just the photo essay, but also how the IGO case reports is a very good medium to start on and submit to more often. And I'm really thankful to her for summarizing everything in her presentation. Dr. Kaushik Tripathi sir has been a reliable pillar of Yosi, and he has trained so many young ophthalmologists over these presentations. Dr. Niranjan from Chennai is actively helping Dr. Anujit, who is the dynamic new in charge of Livewire from Yosi side. And thank you, Anujit and Niranjan, for putting up a great, seamless, show. Dr. Sunanda Haldar, who took the initiative and presented today very well. And I must say that if those, people who really come forward and present, if they don't come forward, we really don't have a, presentation, because one-on-one didactic lectures are very boring. So it's really nice, those people who come forward and present. A lot of people shy away and they're scared, we will not present, we'll do it maybe next time, we'll see this time. So I really want to applaud the efforts of the presenter. And lastly, I want to thank the hot seat participants, because it's your questions and your presence here that makes this entire session so lively. And I'm thankful to each one of you from the core of my heart. Thank you so much from behalf of the entire Yosi Governing Council to all of you.
Thank you so much, ma'am. Dr. Niranjan, can you just have a small certificate distribution and then we can close? You're muted, Dr. Niranjan.
Thank you, Dr. Anandi. So with that, we come to a virtual certificate distribution session for the webinar for today. So at the outset, this is to Dr. Sunanda Haldar for being a participant in today's webinar and presenting a wonderful case report. We would like to thank Dr. Kaushik Tripathi for being a panelist and giving his valuable tips. This is for Dr. Nawazish Sheikh ma'am who's given us excellent tips on how to construct a photo essay, and Dr. Sabyasachi sir, who's given us invaluable pearls on how to choose the right journal for our presentation. That's it from my side. Anandi, over to you.
Right. Thank you so much once again on behalf of Yosi. I would like to thank the entire panel at IGO, especially Dr. Nawaz Sheikh Madam, Dr. Sabyasachi Sen Gupta sir, and finally, last but not least, Dr. Vanati Madam. Thank you so much for being a part and making this a fruitful evening for all of us. I'll just go end